How do you determine if a patient is a candidate for ease or if they should just go right into MMA?
That's a very good question. I'm going to go over the variables. It goes into how I assess a patient in terms of a patient with sleep apnea. Gender of the patient, age of the patient, weight of the patient, the anatomy of the patient, the severity of the sleep apnea, symptoms, if some, and their objectives. Okay. I'm a firm believer. I already said it. Until 2017, overwhelming majority of patient is MMA. I just MMA, 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 MMA. If you see that patient that I didn't bring up, I operated on him probably 15 years ago. Okay, young man, which I didn't. This guy, okay, he was CPAP dependent. Okay, so
Let me put the slide back up. I apologize. Yep, this is the patient you're talking about.
right, 2009 and 2023. Okay, he was CPAP dependent in 2009. Can you see the midface? The midface retracted a little bit.
Yeah, like a relapse of the MMA
It's
almost.
not relapse. No, there's no relapse in this patient. It's lack of nasal respiration.
Mm-hmm.
Okay. Yeah. 2009, I was just doing nasal surgery MMA. He had no soft tissue problems. His soft palate normal and, traditional sleep apnea surgery. And he was CPAP dependent. So I did. And, he was constricted. He has nasal obstruction. So I did the MMA. He's much improved. He gradually worsened. So, I talked about breathing. I talked about the physiology. I talked about all that stuff, which I'm not going to harp on. So increased nasal breathing, in my opinion, is crucial in prolonging the success of MMA.
Right.
Okay.
It stabilizes the MMA.
Because if you are, I tell people, okay, well, the nose is the most restrictive segment of the airway. Okay. That's why. So if you talk about CPAP, a significant amount of pressure that you need is to get the air through the nose so you can treat the back of the throat and the tongue and the sidewall,
Yes.
whatever. Okay. So if your nasal breathing is still an issue, in my opinion, it is going to shorten the success of MMA.
Yeah.
That's number one. Number two, everyone's going to age. Everyone's sleep apnea is going to worsen. That's natural history. Okay. If the patient already has symptoms when he or she's young, I don't want to see patients back 5 years, 10 years, 15 years later. I want to maximize their results. And someday they may need CPAP. Someday. I never tell patients that the MMA is going to last forever because it may very well not. Any jaw surgeon, look, if you go to a jaw surgeon, you know what operation you're going to get?
Wisdom teeth removal.
Okay. I want to get them. I want to set up a basement, meaning that if they, and nasal airway is a significant contributor to difficulty in using CPAP. I know people don't want to use CPAP, okay, but I want to. There are reasons why I do a lot of ease. Why? Because it's quite successful, not 100%, but quite successful. I'm able to improve them, and they have, and I get a base, okay, and it prolongs the success of MMA. Makes, in my opinion,
Yeah. That's
okay.
fantastic.
So this patient, in my opinion, this was 2009. Okay, a bit of a long face. And we could talk about facial aesthetics all day long, and I could talk about rhinoplasty, nasal changes, whatever you want to talk about. Okay, I don't harp about aesthetics because it depends on what the patient's looking for. I am a board certified facial plastic surgeon, by the way.
Well, I can tell you that any aesthetic comments you want to make are more than welcome on my channel, because I would say half of my viewers are primarily interested in aesthetic improvement.
Okay, well, this patient has his nose is a short nose.
Yeah.
You see the upturn?
Yes.
You do any MMA, the nose is going to upturn more. Remember, advancement is going to tilt. It's going to increase the tip.
Right.
Okay, and any MMA is going to can potentially, it will change the nose some. That's why I do a lot of. We're going to go into the esoteric of MMA. Alar cinching, subspinal, blah blah, all the stuff, design, all that. This is not the topic. So, I advanced them. Back in the day, so you could see a bit of a counterclockwise, and I think 12 millimeter advancement, blah blah. Was much improved, but you know what? You could see the gap in the mandible, right? You could see the, it's a decent advancement. It's not 25 millimeter advancement now people talk about and do. And by the way, I don't believe in that, dramatic advancement, because sleep apnea is not just the anatomy. And I repeat, sleep apnea is not just the anatomy. There are a lot of different factors. Okay.
What do you mean by that, specifically with respect to your comment on not over advancing patients?
Okay. Look, how the surgery is done and the degree and how the surgery is designed is a decision between the surgeon and the patient. Okay. Look, I do standard orthodontic surgery all the time. It's not just for sleep apnea. Those patients' desires are a little different, right? So it depends on what they're looking for. But if you're doing sleep apnea MMA, you want to maximize the advancement, okay? You want to maximize the advancement within reason. What I mean by that is that there's a certain amount of physiologic, what I call the physiologic envelope of the muscles, the soft tissues. You could look, in the old days, I used to do what I call intraoperative stretching. When I was young and aggressive, I was trying to stretch it, put in big plates and this, that, over time, there's, you can't fight the tendency to relapse when you overstretch the muscle.
Because the skin and the musculature will elastic back.
Exactly. Okay. I've seen a lot of cases. Okay. When you overdo it, you start putting HAs, bigger plates, blah, blah, blah. Still, it's the stretching, the elasticity isn't just like that. It's over time.
Yeah.
And at the same time, why do I see some young 25-year-old with severe sleep apnea and some 25-year-old don't have severe sleep apnea? Yeah, their anatomy is not significantly different.
That's a good question.
It's not just the anatomy.
Right.
People like to, and that's the problem that I have. Okay, you go see someone with a CT scan, took a weekend course. We're going to do MSE and you're going to have jaw surgery. It's not that simplistic. And that's why you have to understand sleep. You have to study it. You want to gain the knowledge so you could, it's not a cookbook.
Yeah. Do you think a lot of the different phenotype? I'm sorry, same phenotype, different symptoms, right? Some people with the same facial structure will have sleep apnea versus not have sleep apnea. Do you think a lot of that has to do with soft tissue function, like
Sure.
basically
It's it's
myofunctional
it's it's
therapy?
it's soft tissue function. It's um, it's how the brain works. You know, that's why Christian was so interested in, because he was a neurologist. You know how the brain
Who's
works.
Christian? Who's Christian?
Dr. Gimeno, Christian
I
Gimeno.
don't I don't know him. He
Wow.
seems like he was a big influence on you, though.
I worked with him for 23 years. He described sleep apnea, described URS. He's, you know,
Is he deceased
yeah.
now? Okay, may he rest in peace.
Well, funny story about Christian. I used to go to meetings with him. People would present, and he would stand up after the presentation. I would just cringe because he's going to say something to insult that person. Okay. He's not one to hold back. Okay. At the end of the day, I'm not holding anything back. I'm here to tell people what I think. And people can disagree with me, which is fine, but you have to disagree with me with something concrete. And you have to explain to me why you disagree and have something to back it up, not just imagination.
Right, right.
So, anyways, go on. So,
Yes,
so we talk
yeah.
about MMA. So this is the last slide. Okay, I just got an email from this patient. I saw him a while ago. He had MMA, and you could read it. Okay, so on the left, it was my what was the email I got sent.
Mm-hmm.
Okay, and on the right was my note when I saw him.
Mm-hmm.
This is what I see, is that, in my opinion, MMA is way overdone.
Hmm.
Unless your objective is to improve aesthetics, or if that's your motivation, fine.
Right.
Okay. You want to, you want, if you're looking to, to have a Big Mac, you go to McDonald's. Okay. So it depends on what you're looking for, right?
Yeah.
But you it's not the same treatment and the same, you look for someone with a hammer, you're going to get a hammer.
Yeah.
Okay.
Yeah.
That's what I want to emphasize, is that you want to be a little careful, is that all these people, you have an operation, fine, but what are your objectives, and is the operation going to help you? And that's the goal, right? And what is it going to help your aesthetics? Okay, maybe if that's your driving force, great. And now it comes to over advanced versus under advanced, or whatever advanced. Okay, there's no ideal advancement. Okay, it's an advancement where it's going to check your boxes, so to speak.
Right.
And how much risk are you willing to take, and how much you want to push, and et cetera, et cetera. And sometimes it doesn't work out. Sometimes it's not successful, like this patient. And I get that myself, but I don't want that, right? It's not just about doing an operation, it's about being happy. Both,
Mm-hmm.
I'm happy and the patient's happy at the end.
Mm-hmm.
So
Mm-hmm.
go ahead with your questions.
So, just to wrap on this point, when with regards to sleep apnea, you're only as good as your weakest link, and the nose tends to be the weak link with sleep apnea. So if you do an MMA without addressing nasal volume blockages, then you end up right back where you started, in the medium to long term, sometimes in the short term. I mean, this guy did MMA in August 2023, and immediately he knows he's still not breathing well through his nose. And that's going to be problematic for his goal, which is to improve his sleep apnea.
I've seen patients with, oh, I'm really happy with my cosmetic result, but I still can't breathe through my nose, and my sleep is still, I still wake up in the middle of the night. Well,
Yeah.
It depends on what you're looking for, right?
Now, is ease okay to do after MMA, or does MMA complicate doing ease on a patient?
I tell patients that it's always more, because you want the midface to be rigid, right? So I tell them, theoretically, ideally, I like to do the ease before the MMA. Okay. However, have I done many eases after MMA? Yes. Have they improved? Yes. Just like that first patient from New Jersey, he had MMA,
Sure.
and he's still symptomatic, and I see that all the time. Okay.
Yeah.
So this morning I said, how's your nasal breathing? Better.
Yeah.
I'm not saying everyone needs to have the ease. So it depends on, you have to look at the nose. A lot of times I say, hey, you need to address your allergies and this and that. You have to look at the nose. You have to examine the nose. You have to talk to patients about symptoms. You have to look at the anatomy. And there are a lot of different variables.